right, so which of the following is the most likely associated with this patient's condition? So a 50-year-old woman reports to her physician with a 4-month history of intermittent rectal bleeding. She describes the blood to be as bright red as often and often noticed it on the toilet paper after wiping. She denies any pain during defecation or changes in her bowel habits. Her past medical history is significant for hypertension, and her family history is negative for colon cancer. On examination, her vitals are stable, and the external anal area appears to be normal. During anoscopy, bluish dilated veins are visualized in the rectal mucosa above the dentate line. So what is associated with the patient's condition? So above the dentate line makes sense, and she doesn't have symptoms, so it's a hemorrhoid.
Okay.
Um,
Is it internal or external?
it's above the dentate line, so it's internal,
Good. Internal hemorrhoids. Okay.
and it makes sense like why she doesn't have pain, because you only have pain for external. What is the most likely associated with this patient? Inflammation of deficiency, no. Pressure. Hemorrhoid. I might go with the thrombosis of rectal veins here.
Okay. Final
'Cause
answer.
that's technically what a hemorrhoid is in a sense. It's either that or inflammation and ulceration of the rectal mucosa. One of those.
Okay. What do you want to go with?
I'm gonna go with the rectal vein.
Okay, so let's talk about this, right? It's actually an increased pressure of the portal venous system, actually. Okay. And imagine kind of your, you know, in a sense, right? You're putting pressure on it, and the hemorrhoids causes the vessel to kind of dilate and pooch out, right? Deficiency of elastin doesn't really explain that. Inflammation, ulceration of the rectal mucosa you'll see that ulceration, right? Loss of connective tissue in the rectal wall, right? Thrombosis of the rectal vein. Is that acute or chronic?
That would be chronic.
Chronic? A thrombosis is like one clot, right? So that should be an acute issue. Does it make sense?
Okay.
So this scenario is more of a chronic issue, right? And so internal hemorrhoids happen because there's increase within the portal venous system, which dilates and causes kind of a hemorrhoidal plexus. So the vessels kind of get engorged, and they get, there's a possibility of them bleeding. So that's
Okay.
gonna be the best answer. Okay. And so you have the diagnosis, so it's easy to kind of remember, oh, okay, internal hemorrhoids happen because there's an increase of pressure of the portal venous system, which causes hemorrhoids. You know what I mean? That's the reason why they happen.
Yeah.
So
Okay.
thrombosis of the rectal veins happen in external hemorrhoids, which are located below and are usually painful, right? So that's something I learned too. I didn't know that the external hemorrhoids are caused by thrombosis of the rectal veins.
Hmm. Okay.
Okay.